Welcome back to Daytime Ottawa. When we think of respiratory problems, we've been hearing a lot of it in the news. Of course, many of you are familiar with COPD. It is National COPD Awareness Month for the month of November. Also hearing a lot of RSV here in our community here in Ottawa, and of course, certainly across the country. I'm joined by Dr. Shawn Aaron, respirologist with the Ottawa Hospital. Dr. Aaron, welcome to the show. Thanks so much for spending time with us. Really appreciate it. I mean, let's talk about the topic that you're specifically here for. That is COPD. Describe exactly what that is, Dr. Aaron.
Well, Derek, COPD is also known as emphysema, and basically what it is a disease that's caused by exposure to pollutants or exposure to cigarette smoke. And unfortunately, what happens is that the lung sort of gets dissolved out from the inside, and lung function continues to decline, so that people eventually start to develop shortness of breath. The shortness of breath starts on exertion, but eventually, if it gets severe, it can be shortness of breath even when the patient is resting.
How is it diagnosed then?
Well, the easiest way to diagnose COPD is through a test called spirometry, where we have the patient come to the lab and they breathe into a tube as hard and as fast as they can. And if they have COPD, their airflow on spirometry will be impaired, and we'll be able to easily diagnose it based on that test.
So then do they sort of suffer from I guess, what would you call them, like a lung attack of some kind?
Well, COPD is both a chronic disease and an acute disease. So chronically, they usually suffer from chronic shortness of breath on exertion, maybe chronic cough. But then the problem with COPD is that it can also be characterized by acute exacerbations. An exacerbation is basically a chest infection or a worsening of the chronic condition, where the patient gets increasing and worsening shortness of breath and cough and phlegm. And that's when they come into the hospital or the emergency department, usually very short of breath and very uncomfortable.
Are there treatments available, Dr. Aaron?
Oh, yeah, we have a lot of treatments available, both for chronic COPD and for acute exacerbations. The most common treatments we have are inhalers, that is, puffer medications, which work to open up the airways and make breathing a little easier.
My understanding, too, is that the fall and winter seasons are more difficult. Oftentimes, somebody that is diagnosed with COPD, they almost fear those seasons as they see them approaching. Why do we see that?
Well, it's not just COPD, it's any chronic respiratory disease, whether it's cystic fibrosis or asthma or COPD or other lung diseases. Winter and fall are the time when respiratory viruses are circulating in the population and in the community. And patients with COPD who already have impaired lung function are very much at risk for worsening of their COPD when they get a viral respiratory tract infection. That's why these people fear winter and fall, because that's when they typically exacerbate and do worse. How do
they best protect themselves then, those that have a respiratory disease of any kind?
Well, the best protection is always avoiding infection, and the best way to try to avoid infection would be through vaccination. So we advise all of our patients with chronic lung disease, whether it's COPD or another disease, to have their influenza shot every year, to have their pneumonia shot at least once in their life, and to get fully vaccinated and boosted for COVID. So these are things you can do to protect yourself. The other things that patients can do to protect themselves is to stay adherent with their regular medicine. So if their physician has prescribed inhalers, make sure you're using them chronically and regularly through the fall and winter months. And finally, the other thing is we know from COVID is that you can protect yourself from getting acute respiratory viral infections by doing things like masking and avoiding close contact with other people in indoor situations.
We have seen a lot of people coming into our hospitals, and I'm sure you at the Ottawa Hospital have seen it with RSV. I'd like to touch upon that a little bit, Dr. Aaron. Why are we seeing a rise in it? And I mean, this isn't something new. Maybe you just explain what RSV is and why we're seeing a rise.
Well, RSV is also known as respiratory syncytial virus, and it's a virus of the respiratory tract that infects the respiratory tract. And it's communicated in the same way COVID is communicated, through close contact and airborne communication. And the issue with RSV is that in most adults, it's a relatively harmless virus. It'll cause cough and cold-like symptoms, but it won't make people acutely very ill. The problem is in young children, especially infants under the age of 2, these infants have no acquired immunity to RSV. So the first time they get RSV, they're hit pretty hard because they have no immunity. The RSV goes into their lungs and into their airways and causes inflammation in the infant's airways. Now you can imagine an infant's airway is already very small because these are tiny little babies. And so when their airway gets infected with RSV, the airway gets inflamed and further narrowed, and that keeps the infant from being able to breathe properly. And then the infant will present with cough and sometimes fever and also extreme shortness of breath. And they often need to come to the hospital and be seen in the emergency department. This is why CHEO and the other emergency departments in Canada are so overloaded now, because RSV is circulating in our communities.
And I'm sure, Dr. Aaron, that advice that you shared earlier about prevention, the same holds true for RSV, to do that masking and that hand washing and just making sure if you don't have to be around people, try to stay away, especially if you have young children, right?
Yeah, I mean, obviously it's a little harder to keep young kids away from their peers.
Yeah.
And there is, unfortunately, at this point, there is no RSV vaccine, although there is a vaccine that may be coming soon for pregnant mothers who could perhaps be immunized for RSV while they're pregnant to protect their newborn children. But for now, we don't have vaccines.
Right. Dr. Aaron, really appreciate your time today. Thanks so much for joining us. Don't go anywhere. We'll be right back.